Good afternoon, everyone, and welcome to today's HIE office hours session. I'm Rebecca Roberts. I'm with the Office of the State Coordinator for HIE, and I will be your host for today's session. So we're going to give it just a few minutes to allow everyone to transition from their meetings and into the waiting room. So sit tight for just a few minutes, and we'll get started here in just a few minutes. All right. Once again, good afternoon, everyone. We're going to give it just another minute. Thank you for your patience, and we appreciate you being here today. All right, we'll go ahead and get started. So again, thank you everybody for joining us today. Welcome to our HIE office hour session. My name is Rebecca Roberts. I'm with the Office of the State Coordinator for the Health Information Exchange, and I will be your host for today's session. So we are really glad that you've joined us. As we dive into today's sessions, this is really an open opportunity for all participants to ask any questions that are related to Oklahoma's HIE, My Health Access Network, as well as OFMQ and OHCA. So as we kick off today's presentation, I do have a few reminders for everybody. First of all, panelists, if you are joining, please make sure that you are muted while you're not actively speaking. With that said, attendees are automatically muted in the webinar, but if you do have a question, you can definitely use the Q&A or the chat function, and we can address your questions from there. So unlike typical sessions, today's presentation is not going to be sent out to attendees after the session because it's essentially an open Q&A. So our session is going to be recorded. The recording is going to be available on the My Health Access Network website for you to revisit, or you can share that with your colleagues. So before we dive into today's topic, I do want to briefly mention and highlight some valuable OK Shine programs. We have the Connection Fee Assistance Program, as well as the Suitor Select Provider Incentive Program. The Connection Fee Assistance Program itself, if you're not familiar with it, it does cover the one-time fees for organizations that employ licensed healthcare providers in Oklahoma. It really does make it easier and more affordable to connect to the state designated health information exchange. With that said, if you are currently not signed up for the program, you can apply at okshine.gov. And we're going to be dropping in some links in the chat throughout either today's session or the presentation itself. So definitely be looking for those links that are shared. The second program I want to talk about is the Suitor Select Provider Incentive Program. This program actually offers up to a 28% increase for reimbursements for eligible providers. That does include an 18.5 base increase and an additional 9.25 for those that are actively using the HIE. So again, we'll be sharing some application links and other resources within the chat, as well as any other documents that you may need possibly after the session. So you definitely can visit the My Health website to learn more, or the okshine.gov website. So we'll go ahead and get started. I wanted, before we dive into today's Q&A session, I just want to point out a couple of our panelists for today. First up with My Health Access Network, we have Lance Butler. He is the Director of Client Services. Joe Walker, he is the Privacy, Security, and Compliance Officer at My Health, as well as Katie Decker, who serves as the Director of Clinical Informatics at My Health. Our next panelist, you probably are familiar with him, Stephen Miller, who is our Oklahoma State Coordinator for HIE. On behalf of OHCA, Steve also has another role within the agency. He serves as a CTO. We also have Chad Sickler, who is the HIE/HIT Programs Director with OHCA. And last but not least, we have Lindsay Wiley, Executive Director of Oklahoma Foundation for Medical Quality, as well as Ashley Rude, who serves as the HIT Manager with OFMQ. So we are definitely fortunate to have such knowledgeable panelists with us today. I know you will find their insights valuable. So to kick off today's session, we have collected some questions ahead of time that relates to My Health, OK Shine programs, OFMQ, and much more. So what we're going to do is go ahead and get started with those questions. But in the meantime, if you have questions, we definitely want you to address those questions either in the Q&A or chat so that our panelists can answer them for you. So to kick things off, let's see. Let's go with Steve. Can you give us a little bit of an overview or some information on how providers can benefit from participating in the OK Shine programs?
Steve, you are on mute.
Oh.
You have to unmute yourself.
Thank you. I was obeying Rebecca to make sure I was muted. So, okay. Yes. Thanks for that question. Yeah, there are many benefits to being a part of the HIE. I think one of the biggest ones is just overall improved care coordination. If you think about as patients move from one care facility to another care facility, those records don't always transfer. And actually, we find that there's a very small percentage of times that all the records about you are at that facility. So in most cases, the average patient probably has at least records in 5 different systems. So ability to have all those records in one place and be able to see the whole picture, whether it's in the initial intake or as they're processing a particular item, I think that's a big. The other area is that just the ability to reconcile medications, those possibilities of a duplicate medication being given or an adverse drug effect, which I think Oklahoma has over 20,000 adverse drug effects every year. And so helping to reduce those are a big thing that the HIE delivers. And I would think just that same thing for readmissions or emergency department visits. All those things just improve that communication between facilities and between all the providers involved in one's care.
All right. Thank you, Steve. Lance, this question is going to be for you next. This is regarding base participation fees. Can you give us some examples of certain provider types and the starting fee metrics and what those fees include, how they vary by provider type?
Yeah, so our pricing model is, it goes through our finance committee where we make a proposal to them, they evaluate it, and then approve the pricing model for each organization type. And so our pricing model is really, it's a volume-based pricing model, and it's based on the organization's size and expected activity level. And so we use standard metrics across each healthcare provider type to make sure that that is reflected in the pricing model we use. So it allows organizations of all sizes to contribute proportionately to My Health. So to kind of give an example of that is For let's say a primary care provider office, we do it for two Steves, almost three. For a primary care provider office, they're based on prescribing provider, and so we believe that that's like a volumetric for a primary care office is how many providers you've got, is how many patients you're typically going to see. For long-term care facilities, we do it on average daily census. For hospitals, we do it on adjusted patient days. And so it varies across the different provider type and organization type. What comes with base participation? So my health base participation fee, like I said, is, say we'll take a primary care provider. It starts at $55 per prescribing provider, and that is per month. And that covers access to the My Health Provider portal. And then it also goes to cover the cost of feed maintenance and system maintenance to keep everything running as part of that.
All righty. Thank you, Lance. Let's jump to promoting interoperability. Lindsay or Ashley, why does connecting to the HIE benefit providers' patients?
This really helps connecting to the HIE for clinics or inpatient, even nursing home, behavioral health, really any specialty is helpful because it is shown that over 90% of their patients will have some kind of health information in the HIE. So this will help with care coordination when they do referrals, when they're needing test results back from external sources. It'll be there, so it really can reduce staff time and having to call or get those referral data or any data they need. So it's really going to streamline their care and their workflows in their organization.
Thank you. Next question we have is regarding data utilization and analytics. So Katie, this might be in your wheelhouse. How can providers leverage HIE data for better patient outcomes?
Yeah, so our products are all really designed to complement each other. So we've got the provider portal, we've got a care fragmentation alerting report, for example, a care gap alerting report, SDOH screening and referral reports, and those can all be used kind of in conjunction. So, for example, with your care fragmentation alert report, somebody or provider team could use that to outreach to their as a trigger to outreach to their patients following a hospital discharge, try and get them in within that 7 to 14 day time frame that we know reduces readmissions. While they're using that report, they can also look up more context around the hospital event in the portal. Adding to the information that they use when they outreach to that patient. So that's just one of many examples. But yeah, I think that's probably the most one that is front of mind for most people. So
Great. Thank you, Katie.
Mm-hmm.
Next up, Chad, if you want to go over what is the Sooner Select Provider Incentive Directed Payment Program? I know I kind of talked about it early on, but for those that probably joined a little late, could you give us a little bit of a brief overview on that, what it is?
Sure. So our legislation passed a law that offered some incentives to help transition from the traditional Sooner Care program that we were offering to the managed care setup that we now have, the plans with Humana, Oklahoma Complete. And so this program is incentivizing those providers that are providing services for Sooner Select patients. Now the program is limited to a select group of providers, such as physicians, advanced practice nurse, mid-level practitioners, mental health providers, podiatrists, licensed behavioral health practitioners, and anesthesiologist assistants. There's some of these that would not qualify if they're like a state employed physician or if they are rendering services within an ITU facility, FQHC, RHC, which is Rural Health Clinic, dental clinic, outpatient mental health clinic, and community mental health clinics as well. So the program offers a base percentage increase based off of your Senior Select claims reimbursements, and that initial amount is 18.5%. So if you are contracted with one of those health plans and have paid claims for Senior Select patients, then you will automatically receive that additional 18.5% for your reimbursements. If you are also participating with the Health Information Exchange, My Health Access Network, you can also receive an additional 9.25% on top of that. These incentive payments are paid out quarterly, and they are paid typically about a quarter past the previous reporting period. And so, for example, we are probably about 2 weeks out from releasing the next round of payments for the time frame of October 1 through December 31 of 2024. These payments will be issued directly from one of the health plans. But you will have to note that even though you may be contracted with multiple health plans, only one of them will be reimbursing you, and that payment will be include claims that were paid from each one of the health plans that you've had a paid service with. So don't be concerned if you see that only Humana paid you, because it'll include all 3 of the health plans.
Alright.
The one last piece that I didn't cover on there is for certain physicians that provide expert screenings or after hours care, they will also receive an additional $25 per encounter as well. So,
All right. Great information, Chad. I know that this has been a very hot topic at the agency. So if you all do have any questions surrounding the provider incentive program, we'll definitely make sure to have that information provided to you in the chat here in just a moment. We'll kind of toggle a little bit here and look at some of the questions that are coming in through the chat and Q&A. So if any of these questions that we're providing to you today are triggering any kind of questions that you may have, please provide those questions to us in the chat or the Q&A. We'll take a question from Hannah. Are doulas or doula organizations eligible for participation in the HIE? Our organization employs doulas who are non-medical, but they do provide educational and emotional support. Great question, Hannah. Who would like to take this one from our panelists?
Well, I'll start, and hopefully Joe can back me up a little bit. So this particular area is, I mean, I think the first question that you've got to ask is there a HIPAA authorization for those people to use the system? Because typically you're going to need to be in a treatment relationship. If that was the case, there's certainly no reason why we can't connect you. I don't know if you actually use an EMR and those kind of things. And we could give you portal access even if you're not contributing. So, but I do think the key issue is your HIPAA relationship with that patient. Joe, you want to add to that?
Yeah, I think the best indicator to answer that question is, does the doula have access to the electronic medical record system? Because ultimately, if they are in a position where they're making entries in the EMR, or that the organization has determined that they should have that access, then there is going to be a participant that will sign the participation agreement with the HIE, who is, from a HIPAA standpoint, that's the covered entity who has a treatment relationship with the patient. The doula would need to be issued an account to the HIE on the authority of that participant. And of course, that participant, that organization, whoever that is, they'll be the ones whose HIPAA policies will determine who gets access to their electronic medical record systems. And those same policies would typically be applied to who they will issue accounts for the HIE. And I'm not familiar enough with the level of access that doulas typically have to the electronic medical records. So I would hold off on making a declaration on whether or not doulas would have access. I suspect there might be some cases where they would not, and some cases where they would, depending on the nature of the situation. But if a doula is operating independently and applies independently for access to My Health, I can say that we don't currently have a doula as their own participant as a provider, defined within our policy as somebody that we typically grant access to, but that is because it hasn't actually been requested of us before, not because we have anything against it. So if there is a basis for that, and you're in a position of it being an independent doula, and you typically do have that kind of access to electronic medical records, I'd encourage you to apply and give us the opportunity to look at your situation.
All right. Thank you, Joe, and thank you, Steve. Hannah, I hope that helps answer your question. If not, please let us know. We'll take a question from Chelsea in chat. If our ACO is a separate legal entity from the healthcare organization, would independent providers in contract with our ACO be able to bill at the 9.5 increase percent rate if the system is connected to the HIE?
Yeah, so the way the incentive will be issued is the billing provider has to be a participant in the HIE themselves. So it's going to come down to how these claims are actually billed to the health plans and ultimately sent over to OHCA. If you want to elaborate more, we can discuss further either offline, or if you want to, I don't know if we're able to unmute folks and have them elaborate more on their question.
Jackie or Lindsay, is that an option? I think that there's.
I just gave Chelsea the option to. There she is. Chelsea, do you want to expand on that question?
Not sure if Chelsea's unmuted or her mic is working, but
her not. Okay, Chelsea, let me send you our email address, and then if you want to just email me, then we can set up some time to either get on a call or just discuss back and forth via email.
Yeah, and I'll just add a little bit more. My understanding of ACOs, Chelsea, would be that the ACO isn't billing. They are submitting the quality, and you're getting a percent of different ways. So that 9.5% would go to the actual providers. And I think that's what Chad was saying. If the providers themselves are the one contracted with Medicaid, then that's where the incentive, that 9.5% would flow back to if they were connected to the HIE.
Yeah, the checks go. Yeah, you're right. The checks go to the MCE, which will ultimately then go to that provider or organization that billed for the service.
It goes kind of through how the billing is. And I see you're saying that makes sense. So hopefully that clears it up. But if not, please reach out to Chad, myself, or any of us, and we can talk that through even more. But that's how that would work.
All right. Thanks, Lindsay and Chad and Steve. So Chelsea, we will, looks like Chad's already provided some contact information for you in chat. Just circling back to Hannah's original question about doulas and doula organization. She said that it is helpful, but it might be helpful to talk through that a little bit more. So Hannah, the same information goes for you that's been provided to Chelsea in chat. Definitely reach out to OK Shine at the email address so we can help collaborate and coordinate a conversation with you, address any other questions that you may have specifically. So thank you for your questions, and please keep them coming. If you do have any additional questions, definitely feel free to address those in the chat or Q&A. If you do have microphone capabilities, we can unmute you if you feel better doing it that way. Just let us know. So we'll kind of go back to our original Q&A session that we were doing with other questions that we received previously. How do I apply for the OK Shine connection fee assistance? I think probably most of our panelists can answer this, but whoever wants to take it, please go ahead.
Yeah, I'll take it. okshine.ok.gov, and we'll put that in the chat. You'll see a box right there, connection fee assistance. Just pick that. It's a very short application process. We typically turn those notices around within a week or so. So they turn pretty quick. And then you'll also need to complete an application with My Health, which you can also do at that same site. So you can also create your application to get connected, because ultimately we can grant you you'll have a grant in our system, but you can't really take advantage of that grant until you start your connection process. So.
All right. Thank you, Steve. Just to kind of keep on the same topic, which products are available for the one-time fee connection assistance? I think this might be a My Health question, possibly.
I'll jump in there real quick. I just pulled it up. So never mind, I don't have the ability to share. I was going to pull the screen up and show you where to apply at, but
We should be able to get that taken care of for you, Lance, if you give us a second.
I opened it up, so I was like, I'll just show it real quick. But to your question, what is covered by the connection fee assistance? So the connection fee assistance pays for the fees associated with My Health connecting to your EHR to provide those HL7 messages to the HIE. So sending those ADTs, CCDs, or RUs, et cetera, to the HIE. In addition to that, if you have a fee, a one-time fee from your EHR, we can work with you and make an additional application to the state for EMR one-time cost reimbursement as well to help cover those costs.
All right. Thank you, Lance. All right, not seeing any questions in chat or Q&A, so we'll just keep going with some additional questions that we have. This is in regards to the provider portal with My Health. How would a provider or participant submit a provider portal help desk ticket?
That is a good question. I'll take that one. Well, I can share. I will show real quick. Taking a step back, since I do have the screen, and this is the OK Shine website. You can see here the connection fee application is here. Just click there. It's a very short application. And then additionally, once that connection fee application is approved, they send a notification to you that you've been approved, as well as send that notification to us. But if we also ask that you complete the Join the HIE Now questionnaire as well. It's really just contact information for the organization. Let's us go ahead and reach out to you and start the process a little bit quicker and not waiting on the connection fee application to be approved. We can go ahead and get you a quote in hand and start that process and do those in parallel. To the question at hand, this is test patients, so don't worry, it's not PHI up on the screen. But once you log into the My Health Provider Portal, you can see at the top right-hand corner, there is a help feature up here. All you have to do is click on that. There's a free text field. We ask that you put in as much information as you can. This is a PHI friendly help desk, so you can put in the patient's information, their date of birth, first name, last name, date of birth. Really helps if you include that in there about any questions that you have. If it is something that you need a faster response to, we do have our help desk phone number listed up here that you can reach one of our help desk attendants at, or you can also email us at helpdesk@myhealthaccess.net.
All right.
Rebecca,
Thank
can I
you.
go back to connection
Sure.
fee assistance for a second?
Of course, yeah.
But it's real critical that you get these in. The reason being is that when you fill out that connection fee assistance application, we encumber dollars out of the total fee fund that we receive from the legislature. So even if you're not sure when you want to move forward, or exactly if you're even sure, getting that connection fee assistance in now, because at any time, the legislature could say, okay, that's it. So if we have that connection fee assistance application in, that gets you in line to do it. You have a bunch of more decision processes, as Lance was saying, as you fill out your application and you understand maybe what the participation fees are going to be, and so forth. You're not committed, right, until you finally sign those final agreements. So, and even then, you can always, I think they have a 60-day out clause. So, in any case, I just can encourage everyone to get their connection fee assistance applications in. This is probably the best time it's ever been. I mean, between connection fee assistance and if you're eligible for the directed payments, the Sooner Select program, I mean, the HIA will be totally free. And in fact, in most cases, if you see any amount of Medicaid patients, in most cases, you'll actually make money. You'll actually get dollars beyond your base participation. So I just encourage as many people as you can to go ahead and get out there, get it started, and then you can work through the process over the next several weeks or months.
All right. Thank you, Steve. And thank you, Lance. It looks like the connection fee assistance link is posted in chat if you'd like to visit that website at any point. We do have about 15 minutes remaining, but we are still here and we want to help answer any questions that you all may have. So again, just drop those questions in the chat in Q&A. We'll go ahead and take a question or discuss a question about privacy and security. So Joe Walker, when it comes to the data that's within the My Health Provider portal, who owns that data?
The data is owned by the organization that submitted the data to us. That's in the participation agreement terms and conditions, very clearly spelled out. When that data is submitted under that agreement, there is a license given to My Health to make that data shareable for the specific purposes that are approved in that agreement. So that's our basis for allowing other healthcare providers that are involved in the treatment of the patient being able to access those records. But that also means that any uses that are contemplated using the data, we have an elaborate data governance process, and anyone who's participating in the network is also invited to attend our governance committee meetings. And by governance, I'm talking about they have other committee names, but we have a clinical quality committee that meets, that's like doctors that talk about how they use the portal. And we have an operations committee that meets, and we have a privacy and security committee that meets. And so anyone who's part of the network is invited to attend those meetings. Those are the places where we talk about, if somebody has a proposal for something that's not already being done in the HIE, to start doing it with that, you have a right to be in that conversation if you want to be, by attending the committee meetings. And by the way, the process, I'm going on down the line, but I'm illustrating why it's significant that you're an owner, because if through our process, the people that are representing the stakeholders in the network ultimately support the idea of the network doing something new with the data, gets approved by the board of directors, the notice of that change gets sent out to all the data sources, because the data sources own the data, and it's set up so that any data source can say, not me, my data will not be used that way. So you control the data. If you have questions about, what things have been approved through our data governance framework, certainly I'm happy to discuss the nuances or the details of that. But we do have in our network policies, policy number 9, that's on our website, that outlines what the actual permitted uses are. So you continue to own your data, and you're just under the agreement licensing the data to be used according to those permitted purposes. That's how the legal structure is set up. That's probably more information than you really wanted as an answer to that question, but I'm sensitive to various reasons why people might ask that question.
No, that's great. Thank you, Joe.
Hey, Rebecca, let me follow up on that just a little bit. One of the questions I get a lot when I'm out talking about the HIE is that, well, does the state have access to all this data and what are they going to do with it and all those kind of things? Well, the facts are, as Joe just talked about, we're a source just like everyone else. And the only data we have access to is the data for our patients in Medicaid. Okay. And even then, it's only our care managers who are nurses and doctors and so forth who are allowed that access. So I mean, it's not like the government's taking this data and trying to analyze it and do other things with it. That's not one of the acceptable uses. And that committee that Joe talked about, they govern all those type things.
That's correct. Thank you for making that clear, Steve.
Great. Thank you. We'll go back to promoting interoperability with either Lindsay or Ashley. So when it comes to providers and their EHR systems, how can they ensure their EHR systems are compatible with the HIE?
So that is something the My Health team and OFMQ team work with to make sure that they're able to connect. So we have a technical team that works on interfaces and integrations. So once you sign up with My Health and sign a contract and you're ready to go, that's really one of the next steps. You will get immediate access to the patient portal so you can start using it and integrating it into your daily workflow. But then the next pretty much simultaneous step is getting your data integrated into My Health's, so your data can be shared with others, which is the other big point that we want to work on. So we do have different protocols and standard interoperability protocols that we follow that other EHRs are also required to follow. So our technical teams, we set up calls with someone from the EHR, My Health, and the clinic, and we start those integration processes. So it's very likely if your EHR is certified and they should have standard communication technology so the interface can move forward. And some can move forward within days and it's very easy. It's like flipping on a switch. Some take a little bit more development and work, but we work through that and we let you know every step of the way how we're coming about that.
Oh, great. Let me know if you guys are able to hear me. I apologize. I think I've been having some audio issues on my end. So let's see. It looks like there's a question from Rhonda in the Q&A. Let's see. Will our providers receive the incentive if they themselves are not the ones logging into My Health? As a referral coordinator, I log in to access info, but my provider does not. Good question, Rhonda.
Yeah, let me take that. So for the connection fee assistant, connection fee assistance, but really the directed payments program, Center Select, it's not based on utilization at this time. So the fact that you're connected and you're in good standing, basically you're a member of My Health, and you at least have a connection in process, which you don't necessarily even have to be fully connected, but you're using the portal and so forth. That's all it requires currently. Now, as we get into next year, we're going to look at utilization, but that utilization is not going to be at the provider. I'm not going to say, a doctor has to use it X amount of times. I'm probably going to say that your organization has some utilization metric, and mostly we're looking for improvement over time. So we're still a ways away from knowing what those parameters are going to be, but I do believe we're gonna probably begin a utilization metric, but it won't be, because we do have several organizations that have said, hey, my doctor might not be using it, but my care manager might be using it, or my quality department might be using it, and so forth. So we definitely want to incentivize all those uses. So yeah, I hope that helps answer the question.
All right. Thank you, Steve. And Rhonda, let us know if that helps answer your question. I think we have a few minutes left for another question. Let's see what we've got out here. All right, Rhonda did confirm that did help clarify. So thank you, Steve. All right. This is probably just a random question I'm going to throw at our panelists, but can someone provide what information is available in the HIE?
In the patient portal, you mean?
Yes. Yes. Thank
For
you.
okay.
Yeah, Katie.
Good question. So basically what you would see in a typical medical record. So you can see medications, you can see events. So, you know, if the patient had an inpatient admission, ED visit, outpatient visit with their primary care provider, you can see those events. You can see documents like the CCDs kind of summarizing. There you go. Thank you. Those are all the things that you can see. So there are separate. The provider portal visually is kind of broken up into separate widgets. So each of those categories on the left side there have their own little box, and then you can filter by the source that the information came from.
All right. Thank you, Katie. Looks like a question from Rhonda popped up. What are the parameters around sharing behavioral health documents in My Health? And what kind of documentation can we expect to access as well as share from our end? Good question. Who would like to take that?
Let me start, and I might need somebody to take it. I'm going to have to jump from here in just a few minutes, but yeah. So behavioral health data is a little different than medical data and how it gets into the HIE. By law and really by licensure law, most of the behavioral health licenses, they're required to get a patient consent before anything goes into the HIE. Once it's in the HIE, then depending on the role you perform, you may or may not have access to that data. And I don't know if Joe is still here, but Joe might talk about that a little bit more. We've been pretty sensitive on this topic, and we just want to be sure we handle it carefully. But we do think there's value in some of this data being there going forward.
Absolutely. So just to build on that, behavioral health providers obviously have to comply with the licensure requirements. For those patients you do have consent for, we have historically had behavioral health providers sharing basically the high level information about those patients, such as progress notes. And by progress notes, I'm talking about the kind of notes that you would want a primary care doctor to be able to see. It's important to recognize that psychotherapy notes are not included in the HIE. Those are not expected to be sent and are by definition maintained separately by most EMRs because that's what the law requires for that type of information. But it is sensitive. We are looking at ways that we can enhance the control of that type of information. Right now, it's kind of an all or nothing approach where you should only enable the data to be shared with the HIE if you have that consent from the patient. And it's important for a behavioral health provider to make sure that the interface they create with the HIE has that gate in it and that you have full control over and know how that gate works in order to make sure that you're compliant with the law and your policies in that regard. And that you know what data is actually coming from what you can expect access perspective. I think it's still pretty limited on what you will see from behavioral health sources just because of the realities of how challenging it is from a technical perspective to get all those boxes checked. But we are hoping that we can improve that in time, and we are actively working this year actually on ways to advance the state of the art so that we can have more nuanced information and have better controls around what the patient wants people to be able to see so that that can be accessible to other providers through the network when the patient wants that to happen. So more to come on that front, but it's where we are right now. It's kind of a limited limited availability.
All
One
right.
thing I would just like to add briefly here is that even though there's a lot of protocols around the handling of behavioral health type data, I just do want to point out that you do not need to be sending data to the HIE in order to access the data in the HIE. So we do encourage you to go ahead and get subscribed to access the portal so you can at least have that information to help provide the care for your patient.
Yeah, we have many use cases and examples where someone showed up at a CCBHC or someone else, and they said, hey, to have access to the medical record, to see what meds they were on, things like that was extremely valuable. So again, like Chad said, you can get access to the portal and then you can work through any issues that you might have with submitting data. Guys, I have to run, so I appreciate everybody's time today. I'll turn it back over to you, Rebecca, but I really appreciate the questions today.
Thank you, Steve. One last question. Do you have a standardized consent form for behavioral health centers that they use? Not sure if someone from My Health can help answer
Yeah,
that.
I can speak to that. We don't currently. It's something that we certainly could take on as something to pursue, but currently it's something that each organization has to determine what they can do with their own policies. And so that's how it's been managed to date, is on a case-by-case basis. But that's certainly a topic we can take. What we would normally do is ask our participating organizations that have already thought through this to share what they've already done with us, and then make a standard template out of that. So I'll certainly take that as something we can look at producing within the next little bit, because I think I can see how that could be really helpful to behavioral health providers.
All right. Thank you so much, Joe, and thank you, everyone. Just a reminder, we do have additional HIE office hour sessions that are coming up. Visit the My Health website if you haven't already, to sign up for those additional webinars. We will be offering an HIE office hours session that's specifically focused on behavioral health in May, so stay tuned for that. Be looking for the registration on the My Health website. Next HIE office hour session is going to be on April the 16th. So definitely get signed up for that. With that, we definitely want to go ahead and let everybody know that we appreciate your time today. If we were unable to answer any of your questions, or if there was additional follow-up, maybe you weren't comfortable answering or asking those questions today, definitely reach out to us at the OK Shine email address or My Health Access Network email as well. We definitely appreciate you all attending today's session. Please be sure to complete the HIE office hour survey. That's going to be sent out after today's session. So again, thank you for your time and your participation, and we hope that you have a great rest of your day. See you next time. Bye.